If you're over 60, this video could save your life. Prostate problems are exploding among older men, and the shocking truth is, many don't realize what they're doing every day is making it worse. Are you getting up 3, 4, maybe 5 times a night to urinate? Struggling to start your stream, or feeling like you can never fully empty your bladder? Your prostate might be enlarging silently, and it's not just aging. Here's what the medical establishment won't tell you. It's the everyday habits you think are harmless that are slowly destroying your prostate. Things you do every morning, every meal, every time you sit down. As a doctor, I've seen the devastating difference. Men in their 80s with perfect prostate health, while others, half their age, suffer in silence. The difference? They avoided these 10 deadly habits. In the next few minutes, I'll reveal exactly what's damaging your prostate right now, including the number 1 habit that's more dangerous than smoking. This isn't about scaring you. It's about giving you back control. By the end of this video, you'll know how to stop prostate growth naturally, reduce those midnight bathroom trips, and reclaim your comfort and dignity. But you must watch till the very end, because habit number 1 will shock you. Don't let another sleepless night rob you of your quality of life. Share this with any man you care about over 60. Here are the 10 habits silently destroying your prostate, starting with number 10. Habit 10. Ignoring thirst and staying chronically dehydrated. You might not realize this, but failing to drink adequate amounts of water can quietly wreak havoc on your prostate. Many seniors deliberately reduce their fluid intake to minimize bathroom trips, particularly during nighttime hours. However, this seemingly logical approach can actually make your urine highly concentrated, which irritates both the bladder and prostate over time. The prostate is positioned directly beneath the bladder, and when the bladder becomes stressed, it transmits that pressure directly to the prostate. Chronic dehydration leads to widespread inflammation, and inflammation is one of the primary contributors to prostate enlargement. Many seniors are also taking medications that have dehydrating effects, and when they're not consuming enough water, it compounds the problem significantly. A dehydrated body struggles to eliminate toxins efficiently, placing additional strain on the entire urinary tract. Over years, this gradual damage can result in an enlarged prostate and persistent urinary complications. The solution is remarkably straightforward. Drink water consistently throughout the day in small quantities, even when you don't feel particularly thirsty. Aim for urine that's clear or light yellow as an indicator that you're properly hydrated. Maintaining adequate hydration keeps your bladder functioning calmly, reduces pressure on the prostate, and helps prevent unnecessary inflammation and swelling. Don't avoid water out of fear. Instead, use it as your natural protective shield to support optimal prostate health for years to come. Habit number 9. Sitting for extended hours without movement. You might absolutely love your comfortable recliner, but excessive sitting could be causing harm exactly where you'd least expect it, your prostate. When you remain seated for extended periods, especially without taking regular breaks, it places constant pressure on your entire pelvic region. This sustained pressure significantly reduces blood circulation to your lower body, including your prostate. Over time, that compromised circulation leads to inflammation and can directly contribute to prostate enlargement. Seniors who spend excessive amounts of time sitting, whether watching television, working at a desk, or reading, face a substantially higher risk of developing urinary and prostate complications. This isn't about completely avoiding rest and relaxation. It's about incorporating frequent movement and avoiding prolonged periods of inactivity. Your pelvic floor muscles also become weakened when they remain inactive, making it considerably more difficult to completely empty your bladder. This results in residual urine remaining in the bladder, which further irritates the prostate. Developing a simple habit like standing up every 30 minutes and walking for just a minute or two can dramatically reduce this risk. Gentle stretching, light walking, or even taking a few steps around your house can maintain healthy blood flow and relieve the accumulated pressure. Don't allow a sedentary lifestyle to create serious health problems later on. A small amount of movement now pays tremendous dividends in keeping your prostate calm, healthy, and functioning optimally. Habit number 8, consuming excessive amounts of caffeine. Many seniors thoroughly enjoy their morning coffee ritual or an afternoon cup of tea, but consuming too much caffeine throughout the day can significantly irritate both your prostate and bladder. Caffeine functions as a diuretic, which means it dramatically increases urine production and forces your bladder to work much harder than normal. Caffeine also causes the muscles surrounding the bladder to contract more frequently, leading to urgency and potential leakage. For someone dealing with a sensitive or already enlarged prostate, this additional pressure creates a serious problem. But caffeine's negative effects don't end there. It also causes the muscles in the bladder neck to tighten, making it considerably more difficult to empty your bladder completely. This results in more urine remaining in the bladder, placing even greater strain on the prostate. The end result is increased inflammation, more frequent bathroom visits, and significantly more discomfort. While one small cup of coffee is typically acceptable, consuming multiple cups of coffee, strong black tea, or energy drinks throughout the day creates a cumulative effect that adds up quickly. The secret is practicing moderation. Try switching to decaffeinated options or herbal teas after your first cup, and observe whether your urinary symptoms improve. Small modifications like this can provide your prostate with the relief it desperately needs. This isn't about completely eliminating your favorite beverages. It's about finding the right balance between enjoyment and long-term health and comfort. Habit number 7, eating spicy and processed foods daily. Many older adults genuinely enjoy flavorful, well-seasoned food, but spicy and heavily processed foods can quietly irritate your prostate without you realizing it. Spicy ingredients such as chili peppers, black pepper, and hot sauces can increase inflammation throughout your entire body, including your prostate gland. While an occasional spicy meal isn't particularly dangerous, consuming them on a regular basis can lead to persistent irritation, especially if your prostate is already showing signs of enlargement. Processed foods, on the other hand, are absolutely packed with preservatives, artificial flavors, excessive sodium, and unhealthy fats. These ingredients don't support your overall health. They silently undermine it. High salt intake, for example, increases water retention and places additional pressure on your urinary system. Foods like potato chips, canned meats, frozen dinners, and fast food can also significantly disrupt your hormonal balance, particularly testosterone levels, which directly impacts prostate health. Over time, a diet heavily reliant on these foods leads to increased inflammation, unwanted weight gain, and hormonal imbalances, all of which are established risk factors for prostate enlargement. If your meals frequently come from packages rather than fresh, natural sources, your prostate may already be paying a significant price. Focus more attention on consuming natural anti-inflammatory foods like leafy green vegetables, berries, and healthy fats. A genuinely healthy diet doesn't have to be bland or boring. It simply needs to actively protect your health, especially when it comes to maintaining optimal prostate function. Habit number 6, holding your urine for extended periods. We've all done it at some point, held in our urine because we're too busy with something important or too far away from a restroom. However, making this a regular practice can silently damage your prostate over time. When you deliberately hold urine in your bladder for extended periods, it causes the bladder to stretch and strain significantly. That extra pressure pushes down directly on the prostate, which is positioned right below the bladder. Over time, this creates persistent irritation and swelling in the delicate prostate tissue. Seniors are particularly vulnerable to this problem because the muscles that control both the bladder and prostate naturally weaken with advancing age. Holding your urine can also lead to incomplete bladder emptying later, which leaves behind stagnant urine, creating a perfect environment for bacterial growth and inflammation. This can trigger infections that further irritate the prostate and may contribute to increased gland size. Not to mention, the resulting discomfort can significantly affect both your sleep quality and overall mood. To properly protect your prostate, listen carefully to your body's natural signals. Don't delay bathroom trips, especially if you're trying to achieve better sleep at night or reduce nighttime urgency episodes. Developing a simple habit of responding when you first feel the urge can prevent serious long-term problems. Remember, your bladder and prostate function as a team. If one is experiencing stress, the other inevitably feels it too. Don't ignore nature's call. It's one of your most effective natural defenses. Habit number 5, smoking or regular exposure to secondhand smoke. Smoking represents one of the absolute worst habits for your prostate health, and even regular exposure to secondhand smoke can be extremely harmful. The toxic chemicals in cigarettes dramatically reduce blood flow, increase systemic inflammation, and damage delicate tissues throughout your body, including those in your prostate. Smoking also significantly increases oxidative stress, which severely compromises your body's natural ability to repair and heal itself. Over time, this can directly lead to prostate inflammation, enlargement, and even a substantially higher risk of developing prostate cancer. For seniors, this damage accumulates at an accelerated rate. The longer you've been exposed to smoke in any form, the higher price your prostate ultimately pays. Smoking also depletes the levels of essential antioxidants in your body, weakening your natural defense systems against prostate-related complications. Even if you successfully quit smoking years ago, being around active smokers on a regular basis can still negatively affect your health. If you're currently still smoking, have an honest conversation with your doctor about effective strategies to quit. There are numerous support tools available, including nicotine replacement therapies and even natural approaches that can help you transition away safely. The health benefits begin almost immediately. Within just a few weeks, your circulation improves significantly, inflammation levels decrease, and your prostate can actually begin the healing process. If you've never smoked, make it an absolute rule to avoid any exposure completely. This single decision can add years of improved prostate health and dramatically fewer urinary symptoms to your life. It's never too late to start protecting your body properly. Habit number 4. Skipping regular health screenings. Many men operate under the dangerous assumption that they don't need to visit their doctor unless something feels obviously wrong. However, this approach is particularly risky, especially after reaching age 60. The prostate can enlarge completely silently, without producing any obvious symptoms during the early stages. Regular medical screenings are designed to detect potential problems early, before they develop into serious conditions. A simple, routine checkup can reveal signs of inflammation, infections, or abnormal growths that might not be causing any noticeable pain or discomfort yet. For example, digital rectal examinations and PSA, prostate-specific antigen tests, are non-invasive, quick procedures that can often be life-saving. Skipping these essential routine checks means missing your valuable opportunity to take early, preventive action. Some men feel genuinely uncomfortable discussing urinary issues or prostate concerns with their healthcare provider, but the sooner you speak up about any concerns, the more treatment options you have available to manage and address the problem naturally. Delaying or avoiding screenings can allow relatively minor issues to develop into serious conditions, such as urinary retention or severe prostate infections. Seeing your doctor at least once annually to discuss prostate health isn't just about achieving peace of mind. It's a powerful, proactive tool for prevention. If something concerning is detected early, you often don't need medications or surgical interventions. Simple lifestyle modifications can frequently be sufficient. Don't wait until symptoms become completely unbearable. Proactive healthcare is the smartest habit any man over 60 can possibly adopt, especially when it comes to maintaining optimal prostate health. Habit number 3, eating excessive amounts of red meat. Red meat might currently be a staple component of your regular diet, but consuming it daily could be silently contributing to prostate enlargement. Scientific studies consistently demonstrate that a high intake of red meat, especially processed varieties like bacon, sausages, or deli cuts, is directly linked to increased inflammation throughout the body, including the prostate. The saturated fats and chemical additives used in meat processing are major contributing factors. They can significantly disrupt your hormonal balance and raise oxidative stress levels, which directly inflame prostate tissue. In older adults, digestive processes also naturally slow down, and red meat requires considerably more energy to process properly. This sluggish digestion contributes to the overall problem, often leading to unwanted weight gain and increased pressure around the entire pelvic area. You don't need to become a complete vegetarian overnight, but reducing red meat consumption to just once or twice per week can make a tremendously significant difference. Consider swapping in lean protein alternatives like fish, legumes, or grilled chicken, and experiment with more plant-based meals that are rich in beneficial fiber, such as hearty lentil stews or nutritious vegetable soups. These alternatives actively support prostate health while also improving overall digestion. Your body will reward you with fewer uncomfortable symptoms, better energy levels, and significantly improved long-term prostate function. You don't have to completely give up the foods you love, just balance them more intelligently. Your prostate will definitely feel the positive difference with every healthier meal choice you make. Habit number 2, carrying excessive belly fat. As you age, excess weight accumulation around your midsection isn't simply about physical appearance. It's actually a major warning sign for potential prostate trouble. Belly fat actively produces inflammatory chemicals that circulate throughout your entire body, including directly to your prostate gland. This constant, low-grade inflammation continuously irritates the prostate, contributes to its gradual growth, and significantly increases the risk of developing urinary complications. Men with larger waistlines are statistically much more likely to experience an enlarged prostate, frequent nighttime urination episodes, and even erectile dysfunction issues. Carrying extra abdominal fat also severely disrupts your hormonal balance, particularly affecting testosterone and estrogen levels, both of which directly influence prostate size and function. The solution isn't about extreme dieting or drastic measures. It's about making slow, steady, sustainable improvements to your lifestyle. Incorporating a short daily walk, reducing portion sizes gradually, and cutting back on sugar consumption can start effectively melting away that stubborn belly fat. Even losing just a few pounds can lead to noticeable relief in urinary symptoms and overall comfort. Don't forget that abdominal fat also physically pushes against your bladder and other pelvic organs, significantly worsening the pressure placed on your prostate. Achieving a healthy waist size, generally under 40 inches for men, is one of the absolute best moves you can make for long-term prostate health. Don't ignore or dismiss the weight accumulation around your middle section. It's not just excess fat. It's a clear sign that your body is experiencing significant stress. Trim it down systematically, and you'll feel the relief not only in how your clothes fit, but more importantly, in how your prostate functions and feels. Habit number 1. Not managing chronic stress. This is the habit that most seniors completely ignore, but it's also by far the most dangerous for your prostate health. Chronic stress functions as a silent inflammatory agent affecting the prostate. When you're constantly anxious, tense, or worried about various life circumstances, your body continuously releases stress hormones like cortisol. Over time, these elevated hormone levels cause widespread inflammation, persistent muscle tension, and significant hormonal imbalances that directly impact your prostate function. Stress physically tightens your pelvic muscles, which can restrict healthy blood flow and irritate the sensitive nerves surrounding the prostate. It also substantially reduces immune system function, making it much more difficult for your body to fight inflammation or infection effectively. Seniors often carry stress quietly and internally. Financial concerns, family issues, health worries, and it all accumulates over time. The result is more frequent urination, pain, urgency, and a progressively swollen prostate. But here's the encouraging news. You have complete control over this factor. Simple daily habits like deep breathing exercises, light physical exercise, gentle stretching, and even just 10 minutes of quiet, peaceful time each day can bring your stress levels down significantly. Laughter, meaningful social connections, and quality sleep function as genuine medicine for both your mind and your prostate. Managing stress effectively isn't just about feeling emotionally better. It's about actively healing your body from the inside out. This single lifestyle shift can help reduce your symptoms and naturally stop prostate growth progression. It's the single most powerful step you can take today for achieving a healthier, calmer, and significantly more comfortable life. Now that you understand the top 10 habits that silently enlarge your prostate, the critical question becomes, what will you do next? These aren't just minor adjustments, they're powerful, transformative steps that can prevent months, even years of unnecessary discomfort, sleepless nights, and avoidable medication dependency. If you're over 60, the time to take action is right now. Don't wait for symptoms to worsen or become more severe. Start by changing just one single habit this week. Drink more water throughout the day, walk a little more frequently, or say no to that extra slice of bacon. Every positive action counts and makes a difference. Your prostate won't heal overnight. That's not realistic. However, with the right habits and a little consistency, your body possesses remarkable healing capabilities. Thank you for watching this important video, and please, if this information helped you in any way, share it with your friends, brothers, or anyone over 60 who needs this vital information. You're not alone in this health journey, and with the right information and support, you're never too old to start the healing process. Take proper care of your prostate, and it will take excellent care of you for years to come.